Schooling is obviously critically important for children. The job of a child is to go to school and to learn, and schools provide more than just learning. They provide a social context, an opportunity for children to interact with peer groups, to grow socially, to gain social skills. My patients with CRPS oftentimes have been homeschooled for a period of time, even months, sometimes 1 or 2 years, before they come to my clinic and they get the appropriate care for CRPS. And I can understand that because being in the milieu of a school and subjecting oneself to the jostling in the hallway and the teasing of other children, the lack of understanding of other children and teachers is very, very difficult. And certainly trying to concentrate and learn in constant pain is a virtually impossible task. So it's not unusual for children to be homeschooled while they're very ill, or to be on home hospital where the school is providing home material and the child can stay in the safe, nurturing environment of the home. But psychologically, that's not a good place to be. One of our goals, and maybe the most important goal that we have in treating CRPS, is restoring function and restoring the child back to school. Because it's about more than learning, it's about socialization and personal growth, and that's what occurs in the schoolroom. Now, it's not feasible to think about doing that if a child hasn't been in school and has been homeschooled for a period of time. But what we have our children do is to re-enter the classroom in a gradual fashion. It might just be for 1 hour a day after they start to begin to feel better, 1 hour a day, perhaps first period in the morning, and then spending the rest of the day at home, and then gradually increasing that so that over a period of time, they're back in school full-time as they are recovering from complex regional pain syndrome. But there's another factor that I want to bring up here, which is very important. If you're an adult and you're disabled with pain and you leave your job temporarily, there's usually little problem. There's not much of a barrier to going back to work. If you drive a forklift at Costco, when you go back in 2 months or 6 months, it's the same forklift, it's the same pallets of Rice Krispies, it's the same boss and the same coworkers who are waiting for you there, and nothing has changed. But if you're a 10-year-old and you've missed 6 months of 4th grade, when you go back, everything has changed. The subject material has changed, the social networks have changed, the cliques have changed, who eats with whom at lunch has changed, everything has changed. And it's important to realize the enormous amount of anxiety that creates in the mind of a 10-year-old. And that anxiety is a huge inhibition for going back to school. So therefore, it's really important to have a firm plan and to stick with it about how you're going to get the kid back in the classroom. A psychologist to work with your kid is also very, very useful, so they can coach them. That might be a private psychologist that you see on the side. It might be the school psychologist or some kind of a counselor. But it's very important to have a plan, a re-entry plan that is hard and fast, that your child will stick with and work towards working their way back to being a full-time student.